Welcome to your California Town Hall meeting. And just so you know, the meeting's being recorded, so we can post it on our web for those folks in California that didn't get to our meeting. So I think you all know who I am. But I have a lot of staff on the call that I want to introduce because they're really and some other people. So first of all, I have Tracy Lang, the Associate Director.
Good morning.
There she is.
Good morning.
Jennifer Michael.
Good morning.
Assistant Director. Trish Leggett, Instructor of Director of Instructional Design. Trish.
Morning.
Okay. Brian Leonard, Accreditation Specialist.
Good morning, everyone. Hello.
Jason Melcarrick, Assistant Accreditation.
Good morning, everybody.
And Tim Embron, Assistant Accreditation Specialist.
Everyone, good morning.
Tanner Caldwell, he's our IT Support Specialist.
Good morning, everyone.
We have Julia Lastly, our Board Chair.
Hi, everyone.
I have Director Lisa Schmidt.
Hi, everybody.
I have our Legal Counsel, Julia Works.
Morning.
I have Jan Wynn from the JRCNMT.
Hi there.
I have Tracy Peters from the Society of Nuclear Medicine. She's probably floating around somewhere in cyberspace. I have Stacy Wilson from the American Association of Medical Dosimetry.
Hi, everybody.
I have Lynn Roy from the Society of Nuclear Medicine. She also gave testimony yesterday and is the director at Cedars-Sinai in Los Angeles. Lynn, did you get on? I don't see her. So
She's joining right now. Sorry.
Oh,
about
okay.
that.
She on yet, Jen?
I believe so.
Lynn, are you there? I just introduced you to the group.
I'm finally here. Thanks.
Okay, welcome. So what we're going to do is I'm going to give you an update of where the JRCRT is, and then we're going to open the, and then I'm going to allow Julie, our chair, and then Julia to say a few words. But first I want to let you know what the JRCRT is doing moving forward. So some of the things that we're going to do, obviously my testimony was 9 pages long and I didn't have time to do a 9-page testimony, right, Lynn? It was the fastest I've ever spoke in my entire life. I'm going to go ahead and send that 9-page testimony to the Health Committee and the rest of the senators. That's the first thing I'm going to do. Then I'm going to go ahead and contact Senator Rodriguez to ask him to come to the table with us. And obviously I don't want to overload the man, so I would like some key people at the table with me, if you're willing to do that. Anita?
Yes.
Would you be willing?
Yes, of course.
All right. James Merle?
Absolutely. I'll be there.
Okay. James would represent the for-profit. Cheryl Young to represent the therapist.
What did you say the date already? I'm sorry.
I have not.
Okay, yeah, if I'm available, I will be there 100%.
Okay. All right. And if Cheryl can't, Steph, will you?
Definitely.
Jan Wynn to represent JRCNMT.
Yes, definitely.
Okay. Stacy to represent AAMD.
Yes.
Melissa Hahn, is that how you say her last name? I'm sorry if I mispronounced it, from Arrowhead.
Melissa Wynn.
Oh boy, I did really mess it up, didn't I? To represent our hospital-based certificate programs.
Yes.
Okay. Is there anyone else that I'm missing, or would we feel that we need to have a board? How, Roy? Lynn Roy?
Yes.
Okay. Representing, because your real job is a director.
Right.
Okay, that would be great. All right. Thank you all.
What's interesting, just as a director of Cedars-Sinai, we finally got some motion on California Health Association because they were going to be neutral and they opposed yesterday. That's huge, which means I can go to my hospital and now be Lynn Roy, not only representing nuclear medicine, but hospitals with large clinical programs. But if you read the analysis on page 4 at the bottom, they talk about Cedar, the things that already exist for paid apprenticeships. And they mention Cedars-Sinai. We don't have a paid apprenticeship. What we do is we hire high school students. We pay them to do real jobs, clerical jobs, entry level, whatever. Not just in imaging. Imaging happened to be the highest user because we need so many things like tech assistants, escorts, you know what imaging does. And they go on and they do careers in healthcare. We usually keep them on because they're good and they work while they go to school. And I have a long list of the health professions that these people went into. But the point is they've misrepresented us. But the point also is that they look for alternatives. That's an alternative. Clinical sites hire kids who are interested in entry-level jobs to do real jobs. They work, they see what allied health profession they're interested in. They go on and let them work part-time. That is an alternative. So I have a meeting today at 11 with our government relations office to pitch that they will allow me, because I got to get permission to talk as Lynn Roy from Cedars, to also represent Cedars because they mentioned us. So that's an angle I'm pursuing as well.
That's good. Will you obviously keep us in the loop? You're muted.
I know. I will keep you in the loop. If they tell me no. I cannot represent Cedars if I don't get permission. But obviously, I'll wear 2 hats or 1 hat at this meeting.
Excellent. Thank you very much. We're also going to develop a template for the programs to use to send to the senators. So that's where we are. We also had received letters of support we got a letter from the ASRT.
Yeah, but it came in too late.
Yeah, I know, but we have it, Anita.
Okay, so
Finally, jeez.
I understand, but the template idea, here's the downside.
Okay.
You can send everybody bullets and just bullets, because if we cut and paste the same words, it will not count as a passionate plea for this is wrong and here's why. How does it affect me? I had to get rid of my RTCC hat and write how it affected me and CSUN, and the potential for all of you community colleges who are articulated with us for that articulation to go away because we can't pay students. So how I really, bullet points are great, but please everybody here, because everybody's going to get 5 other people to write, not the same letter, at least stick to one bullet point.
All right, we will put something together, some talking points for some people and encourage them to, put their own spin on it. Hang on, Steph, because I want to, Stacy, can you reach out to AAMP and Astro?
Yes, absolutely. And they both said that they would be potentially able to help us, but they just weren't able to mobilize so quickly. So yes, I'm happy to do that.
Okay. We also got support from the Association of Educators in Imaging. What are they? AIRS? So I want to turn the floor over to our chair for a few minutes and then our attorney, and then open up. We have not gotten AHRA, James, but I will reach out to them.
Dawn?
Then we'll open up the floor for you folks. If you please raise that little hand or send a chat. Jennifer's monitoring the chat if you feel more comfortable. So Julie?
Sure.
Lastly.
Sure. So thank you all for being here. Thank you for your support in programmatic accreditation. We've had so many meetings over the past few weeks, and the more we met, the more key points were voiced in opposition of this legislation. And Les's 9-page report would have been a dissertation by the time we got done. It just kept snowballing. So we will continue to be steadfast in ensuring quality patient care and to protect the health of the public. That's our focus. So at this time, I would like to turn this over to Julia Works, who is our legal counsel. And maybe if you have questions, she would be able to address some of those at this time. But thank you all. And by the way, guys, I know 2 people here. I know 3 people. Stephanie was my mentor. I know Cheryl Young, who's therapy, and Lisa. I know Lisa Schmidt. So there you go.
Thanks, Julie. Good morning, everyone, or good afternoon, depending on where you are. My name is Julia Works. I am legal counsel to the JRCERT and have been with them for quite a while. I thank you all very much and echo the sentiments already expressed by Les and Julie for participating now and being willing to step up and protect your profession and the public health of the citizens of California, because I really think this proposed legislation as currently drafted does a disservice to everyone. At this time, the hearing yesterday, the legislation was voted out of the committee, so it will make progression to the floor. That takes some time, and obviously based on the questions of various senators yesterday, I believe that the author will be doing quite a bit of research and reaching out and hopefully communicating directly with Les and that group of invested individuals that can come together and speak with him and try to educate him on why I think that the ultimate goal would be to have the professions exempted from the bill. And I think that there are probably other professions that are pulled under it and don't know about it either. Unfortunately, this came, awareness of this legislation came after it had passed through the assembly unopposed, 75-0. It got voted out of there. So to that end, should you, I realize you're in California, but should you hear of any other states that may have similar legislation percolating, please let Les know so we can keep an eye on things, and hopefully with some success in California, the JRCERT can be successful in other states as well. And I'll turn it back over to Les because I think.
Thanks, Julia. I'm also gonna, they had a lot of questions yesterday. They obviously don't understand. My staff is compiling all those questions, and we're going to be responding to those questions from the Health Committee. So I open up the floor. So if you could raise your little hands. Steph, you want to introduce yourself?
Hi, I'm Stephanie Eatman. I was a program director for many years. I was on the JRC board. I've worked with RHB for a number of years. One of the things that struck me after the meeting was that the earn and learn is not the issue at this point in time. Down the road it may be, but it's not being mandated. What is the huge issue is that getting rid of the JRCERT as an accreditor because it is in the way of earn and learn. So because our standards say that the students can't work as employees, they want to get rid of the JRCERT for that reason. And in California, that would be disastrous.
Okay, I don't know how to raise my hand.
Go ahead, Anita.
I was to this legislation by an insider at the RHB just 4 weeks ago. And he said, are you aware of this? And I went, no. And its title is misleading, and intentionally so, in my opinion. So it's hard to identify, Julie, legislation when it is intentionally misleading in its topic. The fact that I would like to remind, we have a lot of new educators, program directors in this audience. I would like to remind you that, and I've sat on RTCC, this is my 4th term now. And back in the early 2000s, when our new certification head, Frida, came to the top of the pile. She dictated that she was no longer going to accept the JRCERT. And we as educators, and you yesterday, I'm just so proud of all of you, went, what? You can't do that. Because that threw us back into California regs. So your argument, California regs were still mandating that you teach 15 hours of film screen in 2005 and so many hours of clinical processing QC. And nobody had a blank film processor anymore. So I want to remind you, we had to have legislation written to accept the JRCERT. And during they were to update their regs, which they did. But now the regs are from the last set of standards in 2005. So they haven't been updated because they've been using the JRCERT. So if we are not allowed to use the JRCERT, you know, that is the critical issue. Stephanie, you are 100% right. If we are not allowed to use them, that will throw us back into the RHB doing site visits, which they're not qualified to do because they don't even have doing site visits, let alone experts in education, and we'll be using old regs. So you don't have DR in our regs, and you don't even have a fluoro unit that isn't DR anymore. So we can't be thrown back into the, you know, old regs because California can't keep up. Our argument is JRC keeps up with technology, the ASRT keeps up with the curriculum that is used, and we fought it. We got them to accept the JRCERT, and now they're throwing us backwards. So we need to remember that for you new educators. We have power, and we stopped it. So we're going to do it again. Thank you.
It looks like Cheryl Young is next to ask her question.
I don't really have a question. I just have more of a statement. So of course, those of you that were at the House of Delegates meeting over the weekend know that we brought this issue up in multiple different meetings, and we brought this into onto the floor, I guess, on Sunday as a late motion, and we failed by 3% of the votes. So we almost got it into a late motion. But one of the discussions that was had at the radiation therapy meeting, actually, somebody was talking about proposing as an amendment to kind of let them move forward with this, but have a little asterisk with it, was to propose that any program that is less than a year in time, perhaps those could be earn and learn programs, and any program that is more than a year of time could not be earn and learn programs. The argument then came back and somebody said, well, you know, some programs are certificate programs, and so they might not be a full year. And at that time, somebody had commented that if you combine all of the schooling that's needed to get the certificate, then perhaps that would suffice as to make that program more than a year's time. It was just things that were talked about with the members of the at the radiation therapy delegate meeting, at the breakout meetings. It was just something that people were kicking around, like, oh, maybe if you propose this or that, that would suffice, and these people would be happy. But it's not exactly something that I want to do anyways. I just wanted to make sure that everybody that wasn't there got that information.
Thank you. Dawn?
This is Lynn. I'm like Anita. I can't find where I raised my hand. Just a little bit of a different topic. HPN is a health professions network, and they are, and I believe ASRT belongs. In fact, I know ASRT belongs. And it's an organization of organizations, and they have all the allied health. They have respiratory therapy, they have nuclear, they have all different kinds. And we have to reach out to them so that they can reach out to the professional societies that belong and get them involved in California. I know at one point we nuclear medicine was extremely actively involved with them. I think Nikki Wenzel Lamb is on this phone call. Nikki, do you still have a contact that we can call them and let them know about this?
Yes, and Leslie, either I can reach out or I can share the contact with you, either way.
If you want to reach out, that would be
Sure.
taking something off my plate would be awesome. I didn't realize you were with us, Nikki. Welcome.
Okay, go ahead, Dawn.
Okay, so first of all, for those of you that are a little Zoom challenged, on the bottom, when you take your mouse down to the bottom, you'll see the participants chat, share screen, record. Next to that is reactions. If you click on that, that's where you find the hand raising button, along with some of the other reaction buttons.
Thank you.
So there's that. Okay. So my question was to Leslie, when you were going through your committee selections at the beginning of the meeting, I didn't, because I don't know everyone. Did you pick a community college program director person?
I don't, and I apologize. I don't think I did. Do I have a volunteer?
I volunteer if you need one.
Very good.
Okay. Unless you had somebody else in mind, but
no, that's fine. And have I missed anybody else that we need at the table? Nita?
Dawn, I have a question for you.
yes.
You would be an amazing community college representative because of your years of experience. My question is, do you know your senator, and is he key in these kinds of issues?
Well, I thought my senator was at the meeting yesterday.
Well, I want you to find that out. I'll tell you why.
I looked him up and because I recognized one of the guys there, but actually I'm not sure now. So I'm going to have to look up the committee again. But I do have a contact of someone in Orange County that might be able to help us with this as well.
Right. And there was a member of the health committee who raised concerns because in her district is Bakersfield Community College.
Right.
And so I've been talking to Karen about using that contact because if this is going to adversely affect a community college in a senator's district, we ought to target those people. So that's why I want you to find out who your senator is first.
Yeah, well, I did, and it wasn't the person I saw on the list, but are the senators on that committee listed if I go to that?
Yes, if you go to the health committee, all of them are listed, and then you can see their districts and see, because if you're in a key district, you're a double sort of header, so to speak.
Yeah, because I know a lot of the program directors are new now, because you and I are one of the only old holdouts.
Okay, I didn't want to use that word. I said years of experience. But I know that Karen has been around a while too. So I'm just saying, I think we should consider, we don't want to make the committee too big, but your experience, and you were a proponent when we got JRC on board, and we had the legislation, but I want you to make sure your senator is the right one too.
Okay.
Okay, thank you, Jan.
First, I just wanted to thank you all for inviting nuclear medicine folks to join in your discussion today. There's one thing that I think we're going to have to be able to address, and it ties into that last question that the chair asked you, Leslie, at the end yesterday about why we have a standard that says students can't be paid. Because it does raise antitrust issues. And I don't know if your attorneys talked to you about it. I've been talking to our attorney about it. Especially that's a hot button issue because of the Supreme Court's decision with the NCAA earlier this week.
Yeah.
Now, there are nuances between our students being paid and football players being paid. It's just, we've got to be able to address that question and do it in a way where we are confident in our answer and have good explanations about what the differences are and why it matters. And that's what I'm going to be working with JRC NMT's attorney with in terms of writing a new letter from us that will specifically bring up that point, because now that the chair raised it with you yesterday, that's going to come up again. And one last thing I did want to mention, I put it down in the chat, but I have been talking just since yesterday with Tom Smalling. He is the executive director of COARC, the accrediting agency for respiratory care. And it's interesting because he emailed me late, actually during the hearing yesterday, and he was asked by someone in California he knows to jump in on some meeting, and it was actually the Committee for Apprenticeships in California. They were having whatever this organization is that already exists for apprenticeships, they were having a meeting during that hearing. And Tom spoke to them, and I really haven't had a chance to talk to him yet. They wanted to know what respiratory care's issues were, some things like that. But his only statement back to me so far by email was their eye is on the target, and they want, they're representing apprenticeship programs, and that's what they want to see happen. So he doesn't know that he did much yesterday, but there's that committee that maybe we need to be talking to also. They're not tied up in the legislation, but once this kind of goes away, if it does, then we probably need to be more interactive with that group too, so this doesn't come around another way in the future.
Jan, when you write that letter, are you going to address some of the other questions that came out, because they clearly don't understand accreditation?
Exactly. That is my whole point, is trying to go back and look at the questions, particularly that the senators had yesterday, plus any misinformation that I heard the bill's author or the union guy that he kept letting answer his questions on his behalf. Some points that were made by those people or others that were misinformation. That's what I want our new letter to target.
That's right. Okay, very good. Thank you. And I want Julia to go ahead and speak on your question there, Jan, about compensating students. I think the bill has so many issues besides just the compensation part, but I agree with you. They are hung up on it. Julia?
I agree as well, and I did add that in the comments, especially because it was brought up at the very end. Obviously, I think Senator Pan had been thinking about it. The policy doesn't say that they can't necessarily employ students. It's very specific to they can't be paid for the clinical, which would be where the earn and learn would fit in. I know that there was a proposed amendment at one point by the Hospital Association, I believe, to include stipends and scholarships as equating to earn and learn, which they do not, but if they put that in the language of their definition, it would allow the JRCERT to continue to act as an accrediting body. But I agree with you, that is a key point, as well as all the other issues raised by the senators during the discussion. And I know that Les is on board with trying to address all of those questions as well up front, especially getting it to all the senators, but then in the meeting with the author of the bill.
Okay, thank you. Dr. Schmidt, you're next.
Thank you. Good morning, everybody. Where do I start? There's so many levels of discontent with everything that we're talking about. But from my perspective, I think my clinical sites, my hospitals, don't probably know about this bill. And for all those programs out there, are your hospitals going to be willing to pay students to train? Because who is going to pay the students to train? So it's crucial that, and that also changes the liability, as we all know. So from my perspective, my thought is that my hospitals, I want them to take a stand about this as well. And also if they know about it, and they probably don't. And then the other point is regarding the training aspect and the earn and learn. There are a lot of other allied health programs that we may not be including in our discussion. And they are, besides respiratory therapy, but others that are also affected by this. So this will change the nature of schools, not just community colleges or hospital-based, but also private institutions as well. And that will change the nature of our training, and it will also change the nature of the employment pool because it will reduce that down. So there are, you know, again, a lot of levels, and every time I think about this bill, my mind expands because it goes in all these different directions. But those are my points, and thank you for listening to me.
Thank you. JC?
Sorry, I had to unmute. Newbie and fresh green director, still learning, but willing to chip in any way possible. Bakersfield, our senator, she was the one that spoke yesterday, and previous career was in athletics, NC2A Division I and Division II. So if you need help with that, I know I have connections, and I would be happy to research the current climate of the NC2A athletics since that was brought up. So whatever you need me to do, I'd be glad to do those things.
Thank you.
Awesome, thank you.
Tiffany?
So I just had a question. So I'm new a little bit to California, just here for the last 3 years, but in my previous state, I was very involved in legislation. And we had actually a committee that was allied health. And so it was occupational therapy. It was, you know, a combination of educators of different colleges for allied health. And I was curious if we had anything like that in California that we could, because again, it will affect most of allied health industry. If anybody knows, sorry.
Anyone have some input, Tiffany?
No, there is no comparable organization in California. The allied health programs have their own professional societies, and nobody's ever gotten together to have a group. You have to remember how California is. I mean, we almost have a northern group of RTs and a southern group of RTs.
I was in Texas, so it was very big.
Oh, yours is big too. There you go.
But it was
well, we're not as organized.
It was very powerful, and at least in our legislative actions, at least if it worked with allied health, we could come to the table as you know, not just RT, but RT, and all the others, so that we could really have a better stance in some of these encroachment onto our profession. Sorry about that. Thank you.
No, you're right. You're right. That would be a great idea. But as of right now, no. In fact, we don't even have a communication network, so to speak. In other words, I don't know who to call in respiratory. I don't know who to call in. I mean, I know to call Cheryl Young for therapy. That's all I know. So we're not that organized.
Okay, Les, I think that's all with anyone having their hand raised. I've been trying to track the questions. Oh, Rochelle, did you?
Yeah.
Sorry, go ahead.
So a couple of things come up for me. I'm at Foothill College, and I've been a program director for, you know, just a little bit, but I have had experience with the last bill, AB 387. And one of the big things that we did is we got our California Community College Chancellor's Office. We have individuals that are assigned to our regions. We got them involved. Unfortunately, the Chancellor's Office has put the kibosh on that and will not allow them to communicate anything on our behalf. I have a meeting with the California Chancellor's Office on Friday, July 9th, just for 30 minutes from 11 to 11:30, just to discuss some of these issues and to beg for help, basically to say, hey, we're your constituency, not the union. We need your help. And the fact that they're kowtowing to the union really makes me angry. The union needs to focus on helping their own people. Anyway, the other issue is this. We're not focusing enough on accreditation. What does accreditation mean? If a hospital lost Joint Commission, everybody would be up in arms. Nobody would want to go to that hospital. Let's face it. This JRCERT is the same thing as Joint Commission in my eyes. Patient safety, student safety, better, of course, better. But I think that really needs to be the big push, because people know who Joint Commission is. Yes, they would still have the Centers for Medicare and Medicaid, but that's a checklist, just like the RHB is a checklist. There's no quality. Did you do it? Yes. How well did you do it? Nobody cares. Is that really what we want to reduce ourselves to? I wrote to my senator and said, to have Nevada and Arizona and Oregon and every other state have better programs than us, no, not happening. So that's my 2 cents.
Thank you. And Stephanie?
You're muted, Steph.
Thanks. This is just a comment out in left field, but I think it needs to be said. Long time ago, I did a study, and it was very clear that people don't get into these professions because of money. They get into it because they care about the patients. They want to help the patients. And I think some of that would be lost in an earn and learn situation. And it's, you know, the longevity of the people that go through the programs, get registered and work. If money is your motivating factor, you don't stay in the field very long at all, or you stay in and get burnt out and are not productive, or you don't provide good patient care. So that's just, I think, an issue that's it's in the back of my mind that's really important, but not one that we think about a lot. Thank you.
Thanks, Steph. Anything else? So I will go ahead and reach out to Assemblyman Rodriguez and get a meeting set up for us. I'm going to go ahead and get some talking points that for you folks to send a opposition to your senator. I'm going to go ahead and get busy on responding to the Health Committee's questions. Anything else?
Yeah, I've been talking privately to people. And my recommendation is that you look up your senator and you call their local office and you ask to have a meeting with him. Now, you can submit a letter to them, your senator, whether they're on the Health Committee or not, but you need to meet with them with these talking points and say, this is a problem bill. And there were lots of questions in the Health Committee. Health Committee said, you know, I'll support you today, but I want these questions answered and you have the answers. This is a non-support issue. So I'll be contacting my Senator Wilk, even though he wasn't on the committee. And I've already written him a letter, but I will speak with him about how disappointed I am in the committee and their outcome. I think if we all reach out, and if you know your grandmother lives in the Health Committee's district, you write a letter for grandma to send to that senator. I mean, that's what we've done in the past. We have fought by saying, my brother used to live in Maricopa, and the senator who was on that particular committee, I said, Jack, here's a letter. Would you sign this and send this? He did. So we had opposition from the whole state, even though it wasn't, you know, it said Jack Moore, my brother. So think about how you can reach senators while Leslie sends you these talking points. You already have so many good ideas. All of you have been really amazing. But we got to, when I hear Bob Ackerman, Leslie say, oh, we got time, or any of you say we've got time, it goes to appropriations. The only person who can talk there is Philip from RHB. I'm trying to get Philip to say, no, it'll cost us a lot of money versus the analysis that says easily absorbed. But then it goes to the floor right away. We may only have weeks. We don't have months. Okay, I'm done talking. And thank you guys. I'm so proud to be a part of your group.
Thank you. So before we have two people with their hands raised, but before I go on, a lot of the questions that were asked in the chat were answered, but if you feel like yours was not, if you'll just resend it, please. Okay, go ahead, Karen.
Hi, thanks. My name is Karen Lang. I'm program director here at Merced College. It's nice to be in this meeting with all of you. And I wanted to just share a little bit from my perspective. I don't know if it helps or anything, but I know that Rodriguez avoided talking about the financials and all those plans yesterday. I had also watched the previous when he was at the labor hearing, and he had the exact same phrases then too. I didn't know we had all this opposition. I look forward to working with them. So I mean, some of you probably know that. But I think that's the point of this bill. Their end goal is to get the students paid, right? Otherwise, this emphasis wouldn't be on earn and learn. So I will share that our program used to have a stipend for our students. I don't know if some of you have had that experience. We did, and it was in place for decades with our program. But it ceased to exist because our clinical sites refused to pay it. They started, it only took 1 or 2 to start refusing before we had the equity issue, and we were, we wouldn't be able to have it anymore. But I know to this day, even though that stipend's been gone for, more than 5 years, my clinical sites still will tell me randomly, if that stipend was still around, we wouldn't be doing business with you. They still say the money would be a no-go. It's a non-starter. So, that's my experience. I don't think that we would have our clinical capacity if there was anything involved with money. And we noticed that with AB 387, that was that last one a few years ago, that the site said, no, we wouldn't be able to have you. They got rid of us in COVID, right? Most of us, the facilities could drop us like that. So I just think that's something I'm thinking about all the time with this, that it's just not, what's the point of getting rid of our good friend JRCRT if the end goal is really just not going to pan out anyway? So that's my thought.
I think that's a great experience to share. Yeah, sorry, go ahead, Dr. Schmidt.
When I was listening in on the conversations yesterday, some of them were coming from the angle of almost as if they were attacking accreditation and saying, how can we allow this organization to control our programs? And that's an important point there, because they don't understand about accreditation clearly. And the issues behind accreditation, not issues, but the points to make behind accreditation are there that exist for patient care, student safety, and so forth, okay? And they likened, earn and learn to other, apprenticeships for other organizations or construction work, which is not the same, of course, as we know. So it lends to credence to knowing that they don't know what they're talking about in that sense. And, protection and accreditation, that's the goal. So when I listened in, I was dismayed to hear that, because accreditation serves that purpose in many realms. And, I'm also thinking of national accreditation for institutions, like for our program, ABHAS. And ABHAS, I would like to know if ABHAS would come to the table and speak as well. And I think that's next in line, is to reach out and try to get them to be part of this as well. Thank you, everybody.
Thank you. I think we have Melissa, and Stephanie, then Laura.
Good morning. I want to say that our program used to have a stipend as well, but that got taken away because the hospital didn't want to pay the students. And it's just all the expenses. So they're literally saving money by not paying the students, but the students, are, making it through with all financial aid through the community college, because we're associated with them. As into regarding how we are held at high standard. When we had our site visit, and then we had our state inspection, from what I remember, the state inspection wasn't as detailed as our site visit, and they said that they trust JRCERT's site visit. This is coming from our state. I'm like, could we use that point maybe?
Oh, Melissa, you're kind of cutting in and out.
Sorry. I was wondering if we can actually use the state that our radiologic health branch is using the JRCERT's site visit as a standard.
So I think she was saying that the state's radiologic health branch is using the JRCERT site visit as their standard.
Yes.
Okay, RTCC voted to incorporate the JRC standards into the regs. So they were updated from the 1986 regs in 2005, I believe. Don't quote me on that year. So we do have the JRC standards written into the regs, but they're the 2005 and it's 2021, I think. So they're not updated. The RHB did not support the legislation that we put forward to mandate the JRC. They felt that they were forced into it, and they were, because we had legislation that passed right through to say we needed a standard that was higher than what the RHB was providing. So the RHB now, I don't think you can say I don't think we can say, because the RHB won't comment on this. They have refused. And they're by law are not allowed to take a position on legislation. So the RHB can only enforce their regs, which are the 2005. And so for us to say, well, they accept this standard of the JRC, they actually fought it. And if they were to speak to it, they incorporated what they had at the time because of the legislation, not because they support it. So I would be reluctant to use those kinds of words for that reason.
Okay, thank you. Stephanie, you were next.
Well, that may have answered my question, but Anita, would it help to write to Frida or Philip?
No, it wouldn't. Frida will tell you that they are not allowed to make comments about any legislation except during appropriations and how it will impact them financially. Now, we've had a lot of legislation that was stopped at appropriations because it was too expensive. But she will simply say, so that's why, as stated earlier, I have a contact through the back door who alerted me to this legislation. But unofficially through their private email, not their official email, because it's that sensitive of a topic that they get involved in legislation.
Thanks, Anita.
Okay, Laura.
One thing they said at the meeting was that JRCERT was the only agency, but it's not. There's lots of accrediting agencies by the ARRT that our students can use. One thing I think is important that JRCERT's not the only agency. They're not a monopoly or whatever the word that was used, but this is the gold standard. And this is why we create such great students, is because we follow this high standard. And I think that's important that they realize that JRCERT's not the only agency, but we choose this because of the high standards they keep.
So you're talking about regional accreditation?
Yes.
Right. Okay. So, and yes, you're right. I'm not sure we want to open that can of worms because they understand so little about accreditation and how regional doesn't even look at our program, let alone
Correct.
student safety and stuff. The other thing that wasn't mentioned yesterday, and I'm also reluctant to remind them of, is that in the state of California, the RHB is the only approval agency. So I have to be approved or certified by the state of California through the RHB in order to function. I don't have to have programmatic accreditation. So I'm reluctant to say that because I want it and I don't want my dean to hear it because we all want it. You know, for quality, all of the things that you guys mentioned. So I think we need, I mean, if we can't fully educate these people in a couple of weeks, we need to stick to the talking points that Leslie's going to send. This is quality. This is what we want. But if they come up with, you don't need it, and we want you to pay your students, then our argument is our programs are going to go away.
Anita,
Yeah.
maybe it would be helpful if we went through the back door and did a financial analysis of this so that RHB can speak to the expense of starting a program that is actually based in 2021 and is not based on film. And those points need to be said.
Yeah, and I have contacted my contact about making those statements at the Appropriations Committee. So we're discussing what kind of statements will be allowed.
Okay,
But
thank you. Oh,
we don't do the financial analysis. RHB has to.
No. We don't, but we can provide information to them to help them do the financial analysis.
Okay, I don't know how to do that, but you're an administrator, you might.
I'll help you with your contact.
All right.
okay. It looks like Ed and then Dawn.
Hi, everybody. My name is Edward Cramp. I'm a partner in the education practice at the Duane Morris Law Firm. I was asked to join the call today by several of our clients who have programs in this space. We represent both public institutions and nonprofits, as well as privately owned colleges in California and around the country. I've seen this issue of compensation pop up in a variety of different places, the oddest of which I think, and this may seem a little off topic, but it's kind of related, was in the cosmetology area, where there was a spate of lawsuits about 5 or 6 years ago by plaintiffs' lawyers in the wage and hour area who sued cosmetology schools, alleging that students ought to be paid a wage for attending cosmetology school to get their hours to qualify for licensure. And as a part of that, we had a lot of discussions with cosmetology and barbering boards around the country about their rules, which are replete with requirements that, now these are boards, they're not accreditors. The accreditors generally stay out of the space in that area, but the boards had rules that prohibited paying students who are not licensed. And I realize this isn't a licensed occupation necessarily, but the reasoning behind why they prohibited that I thought was interesting. And I think it was Jan who mentioned earlier about the need to explain why your standard prohibits compensation. And just one area to think about here is there's really a fundamental difference from a policy perspective between a student versus an employee. An employee is at the workplace to earn a wage. They're there to provide a service in exchange for the wage in order to earn a living. A student is in school for a completely different reason. They're there to learn a skill or to learn a trade and to receive education from their instructors and their teachers and their institution. When you change that dynamic in an educational setting, and whether it's a clinical or a classroom didactic setting, you really are altering the balance there in a way that's very unfair to the students. The pressures on a student are different than the pressures on an employee. I think it's really easy to understand when you think about a hairdresser. I mean, all of you have hairdressers or barbers. A hairdresser or a barber is there to churn out as many services as they can in as short a period as they can in order to maximize the amount of revenue for their employer, right, or for themselves. That's not what a student is there to do. They're not there to generate revenue or to service a client. They're there to learn so that they can later enter the trade and provide the service that's necessary. So when you add that wage pressure in there to a student, it really is a disservice to the student. And frankly, it's disrespectful to them in what they're trying to accomplish during that really special window of time, which is the only time they're going to have in their career where they can learn and absorb that knowledge in a setting that's not threatening, that's not pressurized, that isn't subject to the controls and restrictions of an employment relationship. Going the other direction, and I think one of the speakers mentioned that when they had some stipends, they had problems getting clinical sites. I think I would need scientific notation to try and document the degree of complication in trying to negotiate the contracts with hospitals about who is or is not the employer of the students who are going in. And I'm just thinking about the general counsel at various hospitals that I know, and their minds collectively exploding as they're thinking about having an employment relationship with students who, for example, might then want to have vacation and sick time and paid time off, and what happens to workers' compensation and what happens to unemployment. So if I'm a student and I get pregnant and I have a baby and I take time off because I can't be in the clinical site because I'm pregnant, do I then qualify for pregnancy disability leave? And is that going to be paid under the California Paid Family Leave Act? And is it going to qualify for unemployment? So the problems just keep multiplying. And I think that what you're going to see is that rather than this opening up opportunity for students to earn a wage while they're learning, which is the ideal, the opposite is going to happen. You're going to see that the opportunities are going to shrink to either nothing or a very small number. And that the opportunities that are there are no longer going to be a true learning environment. It's going to be an employment relationship, which is not what we want at all for our students. So I just offer all of that up as just as a policy perspective, just to kind of think about and appreciate the opportunity to participate in the discussion.
Thanks, Ed.
Thank you. Very, very well said. I just wanted to point out, I researched the senators on the committees while we were talking to Anita's point earlier. So Leslie, as much as I would love to represent the program directors for the community colleges, I wanted to let you know, as far as I'm fairly familiar with all the programs in California. And what I can see is there's a Senator Limon from Santa Barbara, which I know Bruce Oda. And then, of course, as was already mentioned, Senator Grove from Bakersfield College. Because I don't believe there's a program in Fresno, right? I don't see a representative here from Long Beach, right? So, and most of these other cities that are listed, I don't believe there are programs directly related to that city. So you might want to keep that in mind as a representative for your committee, as much as I would love to be on it. I actually have 2 cities because I own 2 homes, so I could contact either area, but I don't have a direct senator representing from those areas. So
that's Bruce, Dawn, and who else?
Bruce, and then what was the girl's name from Bakersfield? JC?
JC.
Yeah, JC Hill. So I believe those might be your 2 direct contacts with your senators that are on your committee here. Anyway, thought you might want to know that.
Thank you.
Okay.
So you would prefer Bruce, would you be willing?
Yes, I'm willing.
All right.
But if you need a backup, I'm available.
Okay, and JC is available.
Absolutely.
All right. Anything else that we need to discuss? Obviously.
Yeah, Bruce, you need to, I've been telling JC privately to make a phone call to your senator's office and make an appointment to talk to them.
I actually made a note of that to actually set up a meeting.
Awesome.
All right, gang, you need to reach out to your senators. I'll get some talking points for you, but of course you need, like Anita said, you need to personalize it. Is there anything else that we need to talk about today? I think this is probably the best way for all of us to communicate.
Yeah.
Thank you, Leslie and Anita, for organizing this so quickly. You all are great.
Yeah. Thank you, everyone. It's great.
We will keep you up to date as things move forward. And like I said, I'll be contacting Senator Rodriguez or whatever, Assemblyman Rodriguez, and try to get a meeting together and keep you guys all posted on that.
We'll be on the lookout for your notes.
All right. Thanks, Bruce. Thank you, everyone, for your support of programmatic accreditation. We appreciate it.
Thank you.